Hello everyone, it's Friggy here, and this is my friend Daniel. Hey Daniel.
Hello there.
Hi. So, we both suffer from paranoid schizophrenia and we were diagnosed by mental health professionals. So, first of all, how are you, Daniel?
Yeah, pretty good right now.
Don't having any symptoms?
Like some are here, but they're not as severe as they can get.
Yeah, I was just a little bit like experiencing negative symptoms, like a bit depressed, but it's not that bad. No tragedy, so it's not so. Yeah, it's not tragic, I would say. Guys, so today,
Yeah, my positive
yeah.
symptoms are like all the time here. The voices are like 24/7, but
Oh,
kind of got used to it.
yes. With time you get used to it, but it's bad that you experience it. So I don't have any voices right now, and that's fucking awesome. But
Yeah, good for you.
my meds are working. Maybe you should do something with your medication.
None of the medication I've tried has helped, so I think I'll just stick with this.
Okay, so let's go further, guys. Today we wanted to talk about our experiences from psychiatric hospitals and how we got there. Also later a bit about mental health system in our countries and of course about mental illness stigma. Daniel, if you want to tell them where you are from, I don't know if you already did, you can tell them. If not, then no.
Yeah, like I won't say the exact place, but I'll say the most western region of the Russia.
Yes, so Daniel is from Russia and I'm from Poland. And we will talk about mental health system in Poland and Russia, at least in our regions. And also a bit about mental illness stigma, but that's later. So Daniel, how many times have you been admitted into psychiatric hospitals?
Yeah, like in government-based ones, that it was 2 times, and in private sector, like more than 10.
Okay, so were you forced there or you went on your own free will?
In the private sector, I went by free will because I felt there's something wrong with me
Mhm.
and just went there. But in government, one time I got in myself, and the second time I was forced in.
Oh, yeah. I've been to psychiatric hospitals 5 times. All of the times was public government hospitals, and I've been forced, I think, 3 times, and I went on my free will 2 times. So, how was it each stay?
Yeah, like I can't describe all of the private sector ones because there are so many,
Hmm.
but they were decent, just boring. No, no, like terrible atmosphere there. Good furniture there. Like it was small, but still, it was comfy.
Hmm.
And the government-based ones are just terrible.
Oh
Yeah,
yeah.
like the first day, like I was shocked at the condition of the hospital. Like I think I even cried for the first 3 days straight. Just
Jesus.
didn't eat, didn't go to toilet, didn't drink water, just cried.
Me
Yeah.
too, me too. So I know your feeling. I know that feel very
Yeah,
well.
the second time went better because kinda got used to it,
Hmm.
and things got better there because like I started communicating with people and just not just walking around the corridors.
Yes, pacing on the corridors.
Yeah,
I'm very familiar with this. Lots of people are just in psychiatric hospitals, the public ones. You are so bored because there are nearly no therapies. I had therapy once a week only, uh, and I
we
was
had
just
no therapies,
no at all.
no at all.
Oh my god, that's dreadful. You know, Eastern European psychiatric hospitals. Everybody like, I've been admitted first time when I was 12 and when I was 19. When I was very young, and I remember that it was very bad. Like, I could smell communism inside. You know, the colors were faded like an old photograph.
Spirit walking through the country, spirit of communism.
Yes, the furniture was broken and old as shit. There were scratches on the walls. People were screaming all day, all night. The nurses were annoyed as fuck and bitter. And no wonder, because they had to clean the sheets from walls. There were some patients that were smelling the sheet on the walls.
Oh,
Yes,
well, that's terrible.
I experienced it 2 times. Once a guy was smelling his shit all over the bathroom, once a girl, and the nurses had to clean it, and no wonder that they were annoyed, because these kind of people should have special kind of care, like 24-hour care, like
Yeah, like we
mentally
have two
handicapped people.
wings.
Hmm.
Yeah, like in our hospital, we have two wings. One is for calmer people,
Hmm.
like they even go outside to smoke,
Yeah.
and the second one is for like in the meaning of the word crazy people.
More extreme cases. uh,
Yeah,
so.
like one of my
Mhm.
friends got there, and there were no smoke breaks. They couldn't smoke at all
Oh
in
my
the
god.
building. Outside the building, they couldn't smoke.
Phew.
Uh, Half of them were in straight jackets. Yeah,
Well,
but
yeah.
like the most popular stereotype about asylums that padded rooms. None of it. There is no padded rooms.
What?
Yeah,
Well,
there is none.
how old were you when you were admitted first time?
Yeah, first time I think I was 17.
17. Okay. Oh my god, I was 12, so I was in a
Yeah,
psychiatric hospital for children, and I don't remember this stay at all, because I was dragged so hard that I was sleeping all the time. Then my mother took me from there because she saw the conditions, and she was like, "No, nope,
my parents wanted to get me out of there, but they couldn't because if you got there, you
it's
have to stay a minimum amount of days.
minimum a month in Russia."
Yeah, minimum amount of days.
Oh my god,
On your first day, there is none of it.
oh my
Like
god.
on your first day, there is no minimum amount of days. But on the second, third, and so on,
Mhm.
you must stay a minimum of 30 days there.
Well, shit, we don't have that
Yeah,
here. Like, uh, minimum was 8 days. I managed to. I had a suicide attempt, right? And they told me that, oh, suicide, you have to go into hospital. So they locked me. I was crying like a bitch, but I got locked in and locked up. And I told them that I wasn't really gonna kill myself. This was for because I just wanted to change my state of mind with those pills. And they said, okay, you can go after 8 days. So phew.
yeah, like here it wouldn't work. You'll still be there for at least 30 days. But if you attempted suicide,
Yeah.
the minimum amount of days is 2 months.
2 months. Oh my god. One
Yeah,
1 week
people
was
lose
enough.
jobs because of it.
Yes,
People lose
I
jobs because of
imagine.
it.
I imagine. I told them that I have to go back to work, and they let me out, but that's in Poland. I didn't know that it's like that in Russia, but now we know. So anything more?
Yeah. Well, the one thing about Russian hospitals and Russian psychiatric hospitals that they're crowded because there is so little of them, like
Mm-hmm.
one per city, and that has to be a big city, like
Uh-huh.
500,000 people, and
Uh-huh.
then it gets a mental hospital,
I see.
and it's crowded. Like in every room, there were 14 beds.
Well, we had like
Yeah,
maximum was 10 in my on one of
yeah.
my stays.
We ate in two schedules.
And how was the food there?
The food there was just bland, like no taste at all.
Ours was
And it was all
disgusting.
like, yeah, it was all like jelly, like some kind of semi-fluid,
Le-
because there were only spoons, and some people had no teeth, so they couldn't
uh-huh.
chew it, and because of that, it was all like paste.
Our was so disgusting that my mother had to bring me food because I
Yeah, my mother
refused to eat
brought me
it.
food too. Mother brought me food too. Like every day, I got a dinner from her.
Well, shit. And what would you say was the most disturbing, most creepy experience for you?
One day, a bunch of guys just woke up and started walking in the corridors.
Yeah.
And nurses got out, started to bring them to their beds, but they pretended like they fell asleep, and then when the nurses left, they just started doing it again.
Mm-hmm.
On the second time, on the third time, they were like banshee screaming at them.
Mm-hmm.
All of our hospital has been woken up because of the scream. All got out. Nurses had to like put everyone back in, and they just kind of sedated the screamers with haloperidol and aminazine.
Uh-huh. Well, damn.
And they were sleeping for the last. They were sleeping like for a day after that.
Uh-huh. That's
They just drugged them so they wouldn't make a mess.
Yeah, that's very usual practice in psychiatric hospitals. They gave you like
Yeah.
the horse kind of dosage to sedate you, to drag you, and you are just out. You are a zombie. That's the usual practice. So, have you ever been in a straitjacket or belted to a bed?
No, never. I'm a calm person. Like
Yeah.
everything that happens with me happens only with me.
Have you seen people like trying to escape?
Yeah, I saw one guy that escaped.
Oh, he did that.
Yeah,
How?
he somehow sneaked how do you call it, a nail there.
Yeah.
Not nail, like a thing that you cut bars with.
Yeah.
And he just cut the bars and left. But we were like on the third level. I don't know how he got out and didn't get hurt.
He's a cat.
Yeah.
Do you wanna hear?
Yeah,
Do you wanna?
But like I think I get the idea how he escaped, because I overheard that some nurses talking about that some how do you call it, some towels kind of disappeared. So he just made a rope from towels.
That's so fucking anime, and that's so fucking cartoon-like.
Yeah,
like
that's
so...
fucking cartoon-like, but well, he was a weird guy.
Okay, so...
And one guy, so like there's a system that the patients serve themselves. Like they go for food, they take out laundry, they clean the corridors and the rooms. And when one guy went for food, of course they were being supervised, but when the nurse came to the building, they were just smoking. He just ran off, like just sprinted to freedom. They called the police on him. And in the evening, he just appeared there with his mother, and his mother said, "It's better for you to be here."
Oh, that's very typical. Like when someone escapes, they usually go to their parents and usually find the person there, and they bring them back.
No, not the police found them. He just went there with her mother.
His mother brought him. Okay. So
yeah, no. Like his mother told him, "You need to go," and he just went there by himself.
Now I get it. Do you wanna hear about my most creepy experience?
Of course.
Okay, so when I got to the hospital at age 19, I had to sleep on the corridor for 2 nights on a mattress. But then I was, because I had a choice, either this or staying in the room with crazy old people, 10-person room. So I chose staying on the corridor. And after 2 days, I was admitted to a 4-person room. And one night, I opened my eyes and saw a girl who before told me that she can feel the bad vibrations from me and that I'm evil. She was very psychotic. I saw her standing next to my bed and staring at me at night. All I remember was her pale face and the crazy eyes, and she was just staring at me without blinking. I have nightmares.
Yeah, that's creepy.
I have nightmares to this day about it. I even got voices like, yeah.
Like that's why we separate the patients, the crazy ones with crazy
We
ones, the
don't.
calm ones with calm
We
ones.
don't. Were you allowed to keep
That's that.
Were you allowed to keep your phone with you?
No, I
No?
weren't.
No?
No, no phone, no player. Like on my
What the
first day,
fuck?
we could have players, but the wires had to be shorter than 1 meter.
Oh my god. So in Poland it's not so bad because I was allowed to keep my phone each time. I wasn't allowed to
Yeah, but
charge. I wasn't allowed a charger. I had to charge it in the nurses, room. But I was allowed to shitpost on 4chan and, on Discord when I was in hospital. Oh my god.
yeah, we don't have it here. Like, but we have a TV there, and we have a lot of books there.
Oh, that's at least that's good that you had books and something to do because it's so boring, guys. When you are in Eastern Europe, like in Poland, Russia, it's really so boring because we get nearly no therapies. I was once on an open ward, open psychiatric ward. Went there by myself, and we had therapies all day. So I recommend you open wards. Like closed wards are for people who are very tired of their mental issues and want to, get some rest. But it will be boring, guys. But if you are suicidal, I recommend you to go anyway, because it's better to stay there than to kill yourself. That's the thing, guys.
Yeah, of course. Like, that's that's not good for you, killing yourself. Yeah,
No,
that's like game over.
yeah, it's a very controversial topic. Maybe we can go.
Yeah, like
Mhm.
let's not dive into that.
Yeah, let's not dive. So maybe we'll go further because I don't want this video to be too long. So, how does mental healthcare system works in your country, and it is possible? Is it possible for everyone to get an insurance and use mental health care, or do you have to go to private clinics?
Yeah, like in Russia, everyone has insurance.
Everyone. So it's
Like
like
everybody. Yeah, like all like the medicine here is free, but if
okay,
you want to, you can go to the private clinics.
exactly same here. Exactly same here. Okay,
Yeah,
but would you say that your mental health care system is like very much developed? You have lots of different therapies and clinics
of
and
course not.
okay.
No, no. The private sector is developed, but the government-based one.
So
They just treat everything with haloperidol, Risperdal, and aminoxine.
I
That's all.
see. It's very similar here. Private sector is okay, especially in bigger cities. I go to
Yeah,
private.
like
Mhm.
private sector sent me to Israel for treatment.
Oh,
Yeah,
so how was it in
it
Israel?
was kind of good, but they went for another diagnosis, and shit broke loose because they took off my medication and I started getting psychotic.
Oh, that's bad. Like when mental health professionals like do the opposite thing, like one tell you that you are schizophrenic and you have to take meds, other tell you that oh you are not schizophrenic, you don't take these meds, and it's so fucking confusing sometimes.
Yeah,
Oh, okay, so mental health care system like insurance one isn't too great, isn't too good in our countries, and I hope it will be better in time. I really do. So Daniel, is mental health illness stigma big in your country?
yeah, it is. If you were diagnosed with this, tell somebody about it, and like all the town will know about it.
Okay.
You won't get into jobs. You sometimes can't get into universities and colleges. You will get denied to be somewhere like cafes when some where someone knows that
Hmm.
you're ill. Like it's very big here.
So it's very similar here. I mean, depression is just like, oh, you are not depressed, you are just lazy, or okay, you are depressed, so what of it? You are sad. Or, but schizophrenia is like a boogeyman. People are scared of it.
Yeah, they are for some reason, but like 96% of the schizophrenic people are not dangerous.
Yes, that's true. Let's say you are looking, you know that someone is schizophrenic and you look bad at him, like you are scared of him, or you gave him the evil eye, and schizophrenic might think you want to hurt him, so he gets defensive and he might do something. That's the thing. So don't look bad on these people. Don't look bad at schizophrenics or bipolar, because they might think that you want to hurt them.
You know what?
Mm-hmm.
In Russia, bipolar is fucking fashion now. Everybody says that
What?
they are fucking bipolar.
What the Why?
Yeah, that's the fashion here.
That's so stupid.
Yeah, it is. The person that like has it, he's like I know one guy that has bipolar,
Mm-hmm.
and he's like, why the fuck are they saying they're bipolar? Do they really want to be like me? I don't
Exactly.
want anyone to be like me.
Exactly, guys. It's same with schizophrenia. I heard that in USA, some people say that they check out like video about schizophrenia and they're like, oh, I must have it too. And that's not cool. We don't want to have it. We are sick, but we don't want to have it. We wish we were healthy, right?
Yeah, that's not like drug trips. Not at
No,
all.
no. That's something
It's
much
not
more
funny.
severe.
It's not enjoyable. It's fucking scary.
It's scary
Yeah.
as hell, and sometimes I wish I would just wasn't bored, but right now it's not so
Don't
bad.
say that.
I know.
Like being born is the best thing that can
I
happen to
now
you.
I know that. Now I'm feeling good and I know, but it was so bad in the past that I was in pain all the time.
Yeah, like all the problems are solvable except death. Yeah,
Yep. Yep. Okay, Daniel, would you agree that mental illness stigma should be broken, and how could we do that?
I think we must break the mental stigma, but we need to develop a sense of understanding of a psychic situation of a person. Like we need to break the stigma that, oh, you're mentally ill, so fuck you anyways. We
Yeah.
need to look at each person differently and decide, is he crazy or not, and move from there. Like, not all mentally ill people are crazy and dangerous to society.
Yes.
Some are. I agree with that. That some mentally ill people are dangerous for society, but not all.
Yes. So.
The,
Mhm.
like the minority is dangerous for society.
Yes.
They must get treatment and must be sometimes be in hospitals because that's the only way to help them.
Yes, but not in the sense that lock them up and throw out the key, but lock them up, heal them, treat them, and see what happens, and let them go if they get better. They might get better.
Yeah, of course.
So
You
don't.
shouldn't lock up any person.
Yep, that's very 50s thing, like mental asylums thing. But
Yeah.
this era ended, and we don't have mental asylums anymore. We have psychiatric hospitals, which are like normal hospitals, but you treat your mind there, and not only. So this is illness. Some people have diabetes, some people have schizophrenia, and we should respect that, right?
Not respect that, just take that into account.
Okay, good enough.
Like you
Fair
shouldn't
enough.
respect that the person got schizophrenia.
No, no, okay, I didn't mean
It's
it
not
like
like an
that.
achievement.
I know I didn't mean it like that. That I think I wanted to say that we should be tolerant.
Yes, of course.
That's the thing I wanted to say. Okay, Daniel, if you have something more to say, now it's the time.
Well, I think I have only one thing to say.
Mhm.
If you see a person that says to you that he's mentally ill, just don't run from him or from her. Don't say that they don't have it. Don't like panic. Just treat him like a normal person. Like he is a normal person, just different in
He
some kind.
he has some issues other
Yeah,
than other
like
than mhm.
like financial issues, like the same thing. Issues are issues.
Yes, so from me, the thing that I wanted to say is that we really wish we didn't have it, but we do have it and we talk about it to spread the information, guys. Daniel, thank you for doing this podcast with me and thank you, my viewers, our viewers, for listening. I hope that it was interesting. So that's it for now. Bye bye.
Goodbye.